can see. So I guess we'll get started. Hopefully Johnny will come back and be able to join us, but we'll just move right on, I guess. For now, I don't want to run over. So good morning, everyone. My name is Fran Kerzner, and I'll be moderating the State of the Fitness, Beauty, and Wellness panel discussion. For the past 5 years, I have been serving as the president of the Sherman Oaks Chamber Foundation, which is a charitable arm of the Chamber of Commerce. The foundation is responsible for painting and maintaining all the beautiful utility boxes you see around Sherman Oaks. We've painted over 60 boxes in the past 3 years and are currently painting or repainting 14 more, with another 10 in the pipeline. So please go out and see them for yourself and appreciate all the fabulous work our local artists have done for us. You can also see pictures of the boxes on our Instagram and Facebook pages at Let's Paint Sherman Oaks. Additionally, I'm the chair emeritus of the Sherman Oaks Chamber of Commerce Board of Directors, where I served for 7 years and was board chair from 2017 to 2019. My involvement in the business community also extends to serving on the board of directors of the Sherman Oaks Neighborhood Council. I have a small business, Design Synthesis. It's a full service interior design firm. We've been in business for 20 years, and as you can imagine, this pandemic has hit us very hard. In my time off, I am a fitness fanatic, spending 2 or 3 hours a day working out, doing cardio, weights, and yoga. And although I've learned to appreciate my Zoom yoga classes, I miss the studio, and I'm ready to get back to that and to the hair and nail salons and my beauty routines. So now, without further ado, let's introduce our panel. First, we have Anna Savaridis. Is that right? Was I close?
We're on the money.
All right, from Meraki Fitness. Anna, can you please tell us about yourself?
Sure, thank you so much. My name is Anna Savaridis, and I am a certified corporate wellness specialist and your wellness expert. I was in corporate America for over 18 years and decided to change all of that and open Meraki Fitness, which means passion, and we have a passion for your body and soul. We focus on corporate wellness and concierge personal training, and we bring advisors in physical, mental, and financial health to businesses and all of our clients in customized packages. So this opportunity with the COVID virus, immediately we pivoted or shifted over to a virtual platform, which allowed us to go not only domestic across the country, but also internationally. So it's worked out quite well for us to be able to reach many more people and bring teams together to connect, which is also such an important part of the virtual environment. So yeah, thanks for having me.
Thank you, Anna. And next we have Dr. Anthony Cardillo from Mend Urgent Care. Doctor, can you please tell us a little bit about yourself?
Sure. Thank you, Fran, for having me here. So I'm Dr. Cardillo. I am the owner and founder of Mend Urgent Care. We have 3 locations that I've opened, one here in Sherman Oaks, and then one in Van Nuys and one in Burbank. We opened our first location in Sherman Oaks 6 years ago now. I am an ER physician. I run a very large emergency department here in Los Angeles as well. I'm trained out of UCLA for my emergency medicine board specialty, and I've been doing this for about 20 years now, managing emergency departments. And like I said, recently opened up the Mend Urgent Care line of business 6 years ago, where we are more focused on urgent care, which is a very burgeoning division of medicine now. Most people we're finding don't have primary care physicians in the new model of healthcare. And so they were winding up in the emergency departments for a lot of routine care. And that's why urgent care has become a real source of healthcare for most millennials and young adults. And then, of course, for all of the acute issues that would crop up that don't need to be sitting in an emergency department, waiting for many, many hours. It's always very disheartening when people are waiting for 5, 6, 7, 8 hours to be seen for something that takes 30 seconds to manage. So that was the genesis of starting Mend Urgent Care. We are a full service urgent care, open 7 days a week, 8 to 8, and we're trying to really help the community, especially now during COVID. We have pivoted quite a bit and have become the leader in the area for testing everyone for the COVID virus. That is the mainstay of our business right now, is basically testing everybody for the coronavirus, including nursing homes and then employee-related services, and going out to large employers to have them all tested. As we reopen now, a lot of the guidelines are stipulating testing to be part of that process. And unfortunately, we have seen a dramatic drop in volume across the board. So that's about me and what we're doing and what we're trying to accomplish here. And so hopefully I can help out a little bit in talking about the health space and where we see it going and what's going to happen to most primary care offices and emergency departments as we progress through this illness.
Okay, great. Thank you. We are, you may have noticed, missing one panelist. He's having technical difficulties. So if Johnny gets on, we will let him introduce himself as well. But in the meantime, let's get on to the questions. The first questions were previously submitted and agreed upon. Then as time permits, we'll take additional questions from any of the attendees. So if you have a question for one of the panelists, please type it in the chat and indicate who it's for. So our first question is, will concierge fitness, beauty, and wellness become the new standard for the health wellness industry? We heard a little bit about that in our keynote, but Dr. Cardillo, will you elaborate on that for us?
Certainly. So concierge medicine was a very small aspect of medicine until recently, and we're seeing that explode, particularly during the COVID crisis now. Because people really don't want to leave their house to come to the doctor's office. And so they are willing to enter into this concierge arrangement with a physician or physician groups. And so large hospital groups now are providing this service where people can actually stay at home and have instant contact via telemedicine to their provider. I know we started doing that in the face of COVID with just testing. And so we rolled out very quickly a concierge platform for testing patients in their home, as it was becoming very difficult for patients. And actually, they didn't want to leave their house to come into the health sector because they were afraid of getting sick, and they still are. And so that has very quickly accelerated this concept of, number one, telemedicine, and number two, more of a concierge platform where a person is willing to pay some outside of their, uh-oh, did I freeze? Hello?
No, you're good.
Am I here?
I'm good.
A little
Okay.
slow.
Yeah. So people are willing to pay a little bit more now for the service to actually have a physician come to their home or come via telemedicine. And they're paying outside of their normal insurance premium to have that extra service. And I think that's going to be the norm as we move forward. All indicators show that this sort of concierge on demand, whether it's on your iPhone or via your iPad or computer, that's how most of us will be accessing your clinician for most of the day-to-day medical complaints and issues that are going. In fact, the entire infrastructure of medicine is changing to accommodate for that. And so it's very intriguing to see that happen.
Great. Thank you very much. Johnny, thank you for joining us. Can you hear us?
I can hear you.
Johnny?
That was.
Okay, wonderful. We are broadcasting. Okay, we are broadcasting. We're on to the first question, but if you would like to introduce yourself and tell us a little bit about yourself, and then we'll go back to the question.
Okay, yeah, I'm Johnny Ciccone. I'm hi. Can you hear me?
Yes, we can hear you.
Okay, cool. Yeah, I'm Johnny Ciccone. I'm a small business owner in Sherman Oaks. My salon's called Headbetter Salon, and I've been doing that for 3 years in Sherman Oaks. Before that, I had a salon in West Hollywood, Beverly Hills area, and you know we were shut down for 2.5 months because of COVID-19, and I got to work on the mayor's task force for reopening small businesses. That was a 3-week, lots of Zoom calls, figuring out what the protocol would be for reopening close contact services in particular was what I was working on, as well as general retail. So I got to sit in on all those meetings as well. So we did, we were very extensive on what, we thought we needed to do. And I think we've been doing a pretty good job. There is a little upsurge in the coronavirus problems lately, it seems like, in LA, and hopefully if everybody takes it serious, we can tackle that. I was reading the questions you guys were writing, and I'd love to help. I think I might be able to bring some insight into that for anybody viewing.
Okay, thank you. Let's go back to our first question, just to renew. It's, will concierge fitness, beauty, and wellness become the new standard for the health and wellness industry? So Anna, it sounds like you've already started doing that as well. Can you elaborate a little more?
Sure, thanks. Before COVID, we actually had concierge personal training. So our model was to go to our clients. So we were very mobile and customizing experiences for our clients on site. So with that in mind, now more than ever, it is concierge because every situation is so different. I think that, it lends to the fact that listening to your clients is just ultimately important right now, and really hearing what it is that they need. I always tell them, I could, create a whole plan for you, but if it's working on, you're eating, but you're eating great, and you really need to work on your heart, what are you going to do? So I have to listen and tailor to the experience of each client, whether that be the corporate experience, especially because we need to listen to the employees through the HR director and hear what they have to say. Like, what are they asking for? A big ask has been meditation. A big ask has been, they love a meditation stretch. And then we have a lot of workshops with one of our International Coaching Federation certified coaches. It does wonderful workshops for mindset, leadership, and executive mindset development. So that's been a really big ask also. And financial health. People are stressed out with their finances more than ever. And before COVID, people would spend 2 to 5 hours on company time weekly working on their finances. And now, if you figure out weekly, monthly, annually, how much, when that number's more than doubled, how much that actually costs you, how much money you're losing, any type of wellness plan is definitely well received. So I feel that concierge is where it's at. And with us, we bring a whole spectrum of wellness to our clients. So we select from what we hear, what they ultimately need, and make those workshops specific so that there is not only the attraction to the program, but the retention in the program. Because ultimately what we're trying to do is reduce chronic illnesses and reduce costs, healthcare costs for corporations, right? So the more people that adopt the plan and sustain within the plan, then the better trend that will show the CFO. I would like to also say that we are WBENC certified, which fulfills a diversity supplier requirement for a lot of corporations that need that diversity vendor to check that box in order to get lots of tax incentives and that sort of thing. So we are WBENC certified. We're certified through the county as a county vendor, as well as County of Los Angeles. And we are also a preferred vendor through the County of Los Angeles as well. So happy to speak with anybody about.
Thank you.
You're welcome.
Thank you. Yeah. Oh, we seem to have lost Johnny again. I was just going to ask him the same question. So, okay, we'll move on. So next question, will the new restrictions on opening business be cost prohibitive in the short term and in the long term? Johnny, are you back? There you are. Did you hear that question? Johnny, did you hear that question? I seem to have lost. Are you there? Okay. Well, we'll see. Johnny, are you there? Can you hear me? Guess not. Okay, Dr. Cardillo, can we ask you that question? Restrictions on opening business, cost prohibitive?
Okay, so for us, we have not had any restrictions on opening our business from day one. Obviously, we were classified as an essential business. And so we didn't have any major economic hit because we weren't able to open. However, what happened in the entire healthcare sector, which is a very unfortunate reality, is that the volumes plummeted, okay? And it's sort of counterintuitive, and most of the people in America don't understand this, and I think they almost look at the emergency medical system, whether it's the ER or the urgent care, the same way they look at 911 with the fire department. So if you think about it, a perfect day for the fire department would be that there are no fires. That would be a perfect day for the fire department. In the urgent care setting or the emergency room set, even the emergency room setting, a perfect day for us financially is when the volumes are busting out of the doors, right? So that's the counterintuitive part. So what happened in the emergency medicine sector and also in the urgent care sector is that volumes plummeted because nobody wanted to come to the emergency room or urgent care unless they were truly, truly deathly ill. So the volumes went down about 70 to 75%, which almost collapsed the entire health system, okay? Because every physician's group is dependent upon that income that's generated from patients coming in the door. And that's the part of our healthcare system we have to deal with, and that's why the single payer system, I think, is getting a lot of traction, is because as of now, medicine thrives when we have more business, like any business. Well, that's the bad part, because the more business we have, that means the more sick people are in general. And we don't want to have that. We want to have just the opposite. But keeping people well really evaporates the entire health system. And so what happened in the urgent care sector is a lot of urgent cares in town just closed down. They went from seeing 30, 40, 50, 70 patients a day down to 5 patients a day. Well, you can't keep your doors open when you have 5 people a day walking in. Financially, you can't manage that. So even though we were all considered an essential business, all the doctor's offices that stayed open had no volume. And they had no volume to support their staff and their rent, so they closed down. Now, we pivoted very quickly and were able to start doing testing, and that helped out tremendously, because the insurance companies were financing the testing for all these patients, whether it was in nursing homes or in the community. And so that helped us a lot in the urgent care sector. But a lot of doctors' offices, unfortunately, had to close down because they didn't have the volume. Now, the saddest part is we saw the same thing with emergency departments. So people don't realize, but ERs are managed by physician groups, private groups. Hospitals contract with private physician groups to come in and manage those emergency departments. And those doctor groups, they bill for professional services. Well, if you went from seeing 200 patients a day in the ER down to 40 patients a day, you can't manage an emergency department. So we were under a lot of pressure. Luckily, the grants from the federal government helped out a lot. And some of the loans, and we're able to survive. But a lot of emergency groups are actually going bankrupt right now. So it had a profound impact on the health sector in the emergency sector, which is the most worrisome part, because you don't want to have decreased staff and financial worries in the emergency sector. And so we're hopeful that this is a learning lesson for everyone, and so we can start managing our emergency safety net with emergency departments and urgent cares the same way we do with the fire department.
Gotcha. Thank you. Johnny, so same question. Will the new restrictions on opening businesses be cost prohibitive in the short run and in the long term? Johnny, did you hear me? Hello? Johnny, can you hear me?
I'm having a little bit of technical difficulty over here. I can only hear one person at a time, and I was listening to the doctor. So were you asking me the same question?
Yes. Will the new restrictions on opening business
Concierge Services?
cost prohibitive? No, we're talking about just in general, will the new restrictions on opening businesses be cost prohibitive? It's the second question.
Hello?
Can you hear? Yeah, can you hear me?
Looks like
It's the
everybody's
second
waiting.
question.
So maybe I'll start talking. No. Yeah. So concierge
It's the second
services as it
question.
pertains to the beauty industry. It seemed like there was actually a lot of house calls going on over the coronavirus shutdowns, and that was something that a lot of the hairdressers needed. I know that it's a little more dangerous, or I personally didn't do any house calls over the course of the shutdowns because I didn't feel safe. Much like a doctor's office, our hair salons, we keep them extremely sanitized, and we're very clean. It's a controlled environment for me, so I feel personally the most comfortable inside of a hair salon doing my services. And it's no, I didn't have any beef with the hairdressers that were out doing house calls. I mean, they needed to do that to be able to maintain their economic situation. It was very, very bad for many hairdressers. We had no place to work, and we weren't supposed to be. So as far as going out and doing house calls, I personally don't want to do it. I know that there are some hairdressers who have not got back to a salon environment yet and are feeling comfortable going out to people's houses. And I know that there are some clients who prefer to have a hairdresser come to their house. That's all well and good. And I do think we're going to see a little bit more of that into the future for a while. But for me personally, I have loads of barbicide, rubbing alcohol, Lysol, disinfectants, and I can really maintain a nice, stable set of it's a nice, stable, clean environment at my hair salon. I think it's the best place for me to do it, the most safe place for me to do it. People's houses, I'm not sure. I don't know their kids running out, how many people they've had come in and out, if it's been clean or not. So, and where do I shampoo them? All of these types of things that we're used to doing. So I'm actually very comfortable in the hair salon doing this type of work. And I think it's the safest place that I can do it. So what has been a blessing, moving forward after reopening, we've been reopened for a month now, is that, with the new capacity restrictions and even with the new safety protocol, I'm feeling like I'm giving a better service to each and every person. So I've been able to really because I got rid of my waiting room, and I'm able to just see one person at a time. So really the type of work that I do is a lot of hair colors, cuts that take a few hours, and I'm able to really hone in on that one person and give a personalized service. My bottom line financially has been, affected because of that, but my customer service has been, it's greater now than it was before because I'm not rushing in between people. So there's, give and take with this, and I've just embraced it. And I've told, my employees to embrace this change because it's going to, allow us to really pay attention to our clients in a different way than we possibly had been before. It was already at our salon, we pride ourselves on that one-on-one interaction, but this has really made us do it. And just seeing people for the first time after this, it's like everybody's been through a traumatic experience. So what I've been able to do is really reach out to the people and have one-on-ones about what's going on in their life as we take care of their hair and everything, and just really pinpoint on that customer service aspect of what I'm doing. And I think I've been having fun, and I've been appreciating my clients and my job and the ability to even work in this environment much more than I think I had before. There's a lot of things that we take for granted, and you take them away for 3 to 6 months, and then you just start appreciating people more. So I know that's kind of what I've seen across the board with the hairdressers that I work with and others that I talk to, is that we're able to connect even better now. It means so much more after it's been gone for a while. So anybody that's watching, wondering about their business, I say focus on the things that you can do to make your experience better in this environment, and find those pathways and those roads to where you can improve your performance and your product that you're giving, because there is a way to win in this now. So that's what we've been trying to do.
Thank
And
you,
I
Johnny.
know that the customers appreciate it a lot.
Okay, great. Anna, do you have anything you want to add?
Sure, thank you. I'll just take a couple minutes. So for the new restrictions, will they be cost prohibitive in the short or long term? For me, it actually, because we did go online, I'm able to incorporate all of my trainers throughout the country as well as internationally at no cost. I mean, I just bumped up my Zoom and that's able to be broadcast. So for us, we were actually able to offer better prices to our clients and new clients because it's really come back in my industry to be of service. So really just, being able to cover the cost of to be able to pay my trainers. But for me, I'm not really doing these sort of services for any type of profit at the time. I think that it's important to be of service for our community and to help our community be well. And, it's interesting, Dr. Cardillo, that you said the wellness industry is depleting the urgent care and the ER. And there's the Eastern Western philosophy of medicine and wellness prevention and then scientific medicine practicing and that sort of thing. So there's definitely a lot of conversation around that. But it's interesting, you could talk about it if it's depleting towards the businesses that need those clients coming in the door to sustain them. And then when we do have an issue that they're not able to be there because they weren't able to sustain through this crisis, it's concerning. So thank you for opening my eyes to that. I hadn't looked at it in that perspective, because I'm always telling people, well, you can spend the money on being well now, or you can pay the doctors later. You're going to spend the money, so you might as well do what you choose to do now. But it's interesting to know how that impacts the facility. So if I have an issue, if I have a medical issue, will that facility that's near my house still be there to be able to help me in my need, right? I mean, I could go to Cedars, I could go to a lot of different places. I'm here based in Beverly Hills. But to go outside of my own daily, I partner with a lot of other wellness professionals such as acupuncture or chiropractor and that sort of thing. And they've been considered essential throughout as well. It's very important for the reduction of stress in non-ergonomic settings. People were forced into remote workplaces, and so their bodies got all jacked up. So they have been considered essential as well in preventive care. And then now with the PPE precautions, even some of my massage therapists who are working through a chiropractor's office. They weren't in a salon. They've actually, just as of this weekend when I touched base with them, they've actually increased their business. There's a constant flow. They do have to break up the sessions to clean more thoroughly in between, just like any other medical facility, doctor's facility, and then take the necessary precautions. But they're really enjoying giving their clients that additional TLC, like Johnny was talking about, and having some scented sheets and having it be just a special occasion, a very special experience, and the clients are responding very well to that. So thank you.
Thank you. That's interesting. So next question, what are the top 3 tips to optimize operations for your specific industry? Johnny, do you want to start that one? Can you hear me? Can you hear me?
Are you asking to speak with me again? I can. Yeah, it's weird how only one person comes on at a time. But in terms of what it's cost to reopen, is it cost prohibitive? We've spent some money, but really it wasn't like a big hurdle to overcome. There was, we got some hand sanitizer stations, and I had to get some storage because I got rid of like 4 of my chairs. And I went and bought a little iPad for the salon. Kind of wish I had it right now. I went and bought an iPad for the salon and like a touchless card reader. And, there's more, solvents and disinfectants that we've had to buy. But really, it hasn't been cost prohibitive, those things. But what has, been an issue is people coming back to work. There's a few of the employees who are still on unemployment who haven't been willing to return yet. I understand that. Everybody's got to, take safety into their own hands and do what's best for their families and things like that. But those issues of the not being able to open, for 3 months, those were hard obstacles to overcome. And then just having limited capacity, these are hard obstacles to overcome. So really, the restrictions on the business as it is currently is hard to overcome. And I know that Anna had said that she's really not operating at a profit, and neither am I. I'm really just trying to tread water and stay alive until there's a time where we can be profitable again. That's not my concern right now. My main concern, what it hit me, it goes back to the customer service thing. After about 3 months, like my phone was blowing up so much on, people needing haircuts, wanting haircuts, and I wasn't willing to go to their house, so it was a matter of, if I don't get back to work, then I'm going to lose these people to people that do show up for them. So I was, adamantly trying to get salons open. And, I got to the point where I was about to start doing that. Luckily, Governor Newsom had allowed us to open up again. But, right now I'm really just trying to take care of the people, trying to keep myself from having to go bankrupt. These are my main concerns right now. So there are a lot of issues financially for businesses in my sector, but right now mainly I'm just trying to keep moving forward. Willing to spend some money there. I did get lucky, I feel, with some of the government resources that were offered to me in my business, so I was able to utilize that a little bit. But even that creates a problem for later, right? So I got some loans, cool, great, but I'm gonna eventually have to pay those back. So, those, I've been really careful not to overstep, what I perceive I can handle in the future. And I definitely urge anybody else in a similar situation to beware of some of the loans that you might be getting, and realize that you're going to probably have to pay that back. I mean, there's a bottom line for everybody, and I had to take an educated look at what I can handle and then what I can handle in the future. On the bright side of that, I think a lot of people are going out of business. A lot of, especially salons and businesses like that, they're just choosing not to reopen. So I'm kind of banking on the fact that whoever does stay open is going to reap the benefits of that. Just automatically, there'll be a smaller pool of competition, and I already do feel that. And then in terms of safety requirements and everything, I am noticing that I've had inquiries, people come wanting to rent a chair or come work at my salon because where they're at is too busy and too dirty. And I know that when I was working with the mayor's office, it was something that I brought up that I didn't think that they realized, is that we're driven by customer satisfaction, definitely in my business specifically. Where is, if we get one bad Yelp review, like about this place is overcrowded and dirty or anything, like if I get any action like that on social media or on the internet, I might as well kiss it goodbye. We're built on reputations and alone. The business in my stature is built almost exclusively on reputation. So I have to keep a stern eye on what we're doing and how our clients perceive what we're doing. And now more than ever, I mean, it was like this before, but now in this environment more than ever, we have to maintain an extremely sterile environment because our clients are going to be critical of that. So in terms of I'm going to do, I'm going to pay out whatever it takes to be able to give the clients what they expect. So, any money spent on, PPE and keeping the place sterile is money well spent, especially like lately. So I've been kind of enjoying that. And then also, reaping the benefits of the competition who may not be doing it as well. So anybody in any of these industries, step it up and you'll be rewarded because of it.
Thank you. Okay, great. I think we're gonna, since we're getting close on time, let's skip to the fourth question, if that's okay. Unless you have something you want to say on the third one. But the fourth question is, are there inefficiencies that will require lawmakers to fix? And if so, what are they? And what would you suggest as a solution? Doctor, can we start with you on that one?
Well, certainly. I think for the medical establishment, the biggest problem we have, like I mentioned earlier, is that you can essentially dismantle an entire medical system under these circumstances. The time at which our society needs to have physician offices open, whether it's urgent care or primary care or emergency departments, the successful operation is dependent upon volume, and that's the biggest issue, right? And so we need to have legislative changes where they are funding the health sector the same way you fund the fire department, for example. When it comes to emergency services, whether it's emergency departments or urgent cares, and even primary care doctors' offices that are taking care of a lot of ill patients, they have to be subsidized in some capacity to maintain full operations. Otherwise, you will see the collapse of the health system. And unfortunately, most primary care doctors' offices are closed right now. Actually, just starting to reopen, but now the surge is happening again, and so they're closing again because they can't schedule patients to come into their office. Who wants to go see the doctor right now if you're well? Nobody wants to see the doctor to have their hypertension, their diabetes, any one of those chronic illnesses checked on because they're afraid of getting sick. And so even in the emergency department, people are delaying coming into the ER. They're having chest pain, abdominal pain, and we're getting our hands on them in very late parts of their presentation where they're being rushed to the operating room because they're afraid to come to the medical sector because the volumes have plummeted and we can't operate. And so a lot of offices have closed, and that's a travesty. Imagine if the fire department closed right now because they couldn't fund their operation because there were no fires during COVID. I mean, that would be horrendous trying to call 911 if you're having a fire in your house. So I think we have to have changes from the federal government down on how we finance healthcare. It just has to change. It cannot be a fee-for-service model anymore. That we're realizing that has got to change. It has to be financed the way other governments do it. And we're seeing firsthand what happens during a crisis like this. We've never really had this sort of crisis in our country that really pummeled the healthcare sector like we do right now. And we're seeing what our inefficiencies are and what our sore spots are. And one of them is that medicine is a volume-based business, and that's a big problem, right? It should not be that our enterprise should not be a volume-based business. I shouldn't do well as an ER doctor, an urgent care doctor, if I have more sick people. That's a backwards model, okay? And we are seeing now that that model is being destroyed. So we have to have governmental intervention to make sure that we are now subsidized in some capacity so our offices don't close down during these pandemics.
Yeah. Thank you. Anna, what about in your industry? Do you see anything that the lawmakers need to do to change?
I just like to mirror Doctor. I have so many friends that are international and they just go back to their country for free healthcare. I mean, the whole thing needs to be redone. So good luck with that. I think on my end, my struggle is, that's a whole conversation. My struggle is definitely with AB5, which circles around 1099 independent contractors. It really is prohibitive for small businesses. In my regard, there's no reason for me to have an employee. I set them up and I basically route them to where they need to go, and then they take care of the client. They invoice me, and then I bill the client, and then the definition. I've had to deal with so many lawyers, and to be able to set up, the workman's comp, it just doesn't fit my business model, and mine is not just starting. So for those that are just trying to start or expand in this environment, there's no way anybody's going to be able to hire an employee Because if you have one, you might as well have 20. So I've actually gone through I belong to the Chamber of Commerce here in Beverly Hills, and we're working with some petitions to try to get a little bit more of a bigger ear to listen to that. And we're not getting very far, unfortunately. There's just too much involved with it. But it's, I don't know, Johnny, if you deal with that in your salon where you have you contract out, or if they just lease the space from you. But I have like 7 trainers, and they're all independent contractors, and I don't really need. I play black and white with that, where I'm very clear in my contracts. I'm very clear in the invoicing. Like if I'm to be questioned and or audited, then I'm able to speak of it by several different lawyers. But it's like, it's prohibitive for the independent contractors too to just be able to service different people and expand their businesses. So in a small business sense, it's very prohibitive.
Yes, it is. AB5 has completely changed the way that all salons run, I think. I mean, I came up 20, 25 years ago doing hair, and we were all independent contractors, and it was like a commission-based system, and it served me well. It taught me how to go out and meet clients. It put a lot of the responsibility on, my end, and I had to go out and get my clients and get my life going and make my money. And I built my business that way. It's been nearly impossible the last 2 years for me to relay that sort of work ethic to employees. And it's kind of sad because, as a hairdresser, we can make $100 an hour. But then, I have young hairdressers who, want $15 an hour, and that's I don't even speak that language. So it's been really hard for us to move into AB5, but we have done it. I do have a couple employees, and I do have a couple chair renters, and those they are different. I do treat them differently. I found a way to make it work. And I know that for like yoga studios, massage, dance, those types of things, it doesn't really make sense to have everybody as an employee. I know it's not good for me, and I know that there are other businesses that it's even worse for. And I just, for Dr. Anthony, people are not talking about this enough, how bad the medical industry is doing. I think, the messaging that I received as just, a consumer of medical stuff is like, okay, here we go. Coronavirus, COVID-19. We're bringing in every nurse from all around the world to come to LA. And, I'm sitting here thinking that, you guys everybody needs to work right now. But every doctor I've talked to says they're doing nothing, and I have a bunch of clients that are doctors and a bunch of nurses. And basically I had some people at Cedars saying, we're sitting in an empty hospital, everybody's bringing us cookies every day and we have nothing to do. So I think somehow, for the medical guys, because I know it, and I'm really glad to hear doctors saying that, maybe the single payer system is a good way to go. And by the way, I did go to Mend Urgent Care and took an antibody test. And it was partially covered by my insurance. So it was a good thing to do. I guess negative. So we'll see. But, anybody that hasn't, it was a decent experience, going down there. They stuck a big needle in me, took my blood, and told me I hadn't had coronavirus. So, if that's one thing that men can do, I think I'm going to try to do it, every, month or something like that. Doctor, I'd like your opinion, actually, being kind of now like, in the public so much, we're seeing a bunch of people. Would you recommend that I did take a actual coronavirus test as well? Because I did have one person say that they knew somebody that had it. So I went down there, it turned out I didn't have it. But would you recommend that, if we're working with the public, that we go down and take a coronavirus test every 2 weeks, every month, or kind of be on top of that? Or is it better just to kind of stay away from that all the way? I don't know if you heard that.
Dr. Cardillo, did you hear him?
No, I can't hear Johnny.
Dr. Cardillo, did you hear Johnny?
Yeah, I can't hear Johnny at all. So if you,
Yeah, ask him.
Oh,
if you
sorry.
can repeat the.
Okay, Johnny asked if people in his industry who are in high touch industries like that should be getting coronavirus testing like every 2 weeks or every month or not at all. What's your opinion?
Yeah, certainly. I think 100%. I think anyone in high touch, high traffic, high patient contact industries need to be getting tested at least every other week. And certainly when any symptoms were to begin, that's the only way we're going to really get our hands on this viral transmission. It's certainly PPE, making sure everyone is covered properly, both the patient, the patron and the salon personnel, but it is very wise to get everyone tested every 2 weeks. We're seeing a lot of patients that are either asymptomatic carriers or pre-symptomatic. And it's amazing how casual the contact has to be in order to get infected. We have a lot of people that are just having very, very minimal contact with others once they have emerged out. And unfortunately, what we're seeing are a lot of young people that are critically ill now that are winding up in the hospital. The overwhelming majority do very well, and they have a quote unquote flu-like illness, fever, body aches, myalgia, sore throat, headache. But about 10 to 15% are winding up in the hospital very sick. So we highly recommend that people are testing routinely. And that is the only way we're going to get our hands on this to prevent severe disease.
Okay, well, thank you. Well, I don't see any questions in the chat and we're out of time. Did you have, Anna, you had something you wanted to say?
No, because I have to jump.
Okay, so thank you. Okay, thank you, Johnny, Anna, and Dr. Cardillo. That was a wonderful discussion. We invite everyone to visit our virtual exhibitor booths. Click on Expo in the left menu, and at 10 a.m. head over to the main stage for the workshop, Change Your Mind, Create New Results. Just click on stage in the left menu bar. Thank you all for attending.
Thank you.
Thank you to our
Bye-bye.
panelists.
Thank you.
Bye,
Thank
guys.
you.
Thanks, guys.
Bye.